Maternal Awareness of Home Accidents in Children Aged 0 to 3, a cross-sectional study. Yesem Turul Ejman Turul. Introduction. Children and the elderly are at higher risk of accidents due to their physical characteristics or health conditions, and in many cases of home accidents, HAs, individuals in the early or late stages of life are the most vulnerable. Children are at a high risk of HAs because they are unable to recognize dangers, are more exposed to environmental risks, and possess a naturally curious disposition. From a public health perspective, child injuries resulting from HAs represent a significant concern. Globally, HAs are linked to the deaths of approximately 1 million children and injuries to 10 million children annually. Of these injuries, 95% occur in underdeveloped and developing countries. In developed countries, injuries are responsible for 40% of all deaths among children. Injuries such as burns, falls, poisoning, cuts, and drowning often carry a social dimension and are more commonly observed in economically disadvantaged communities. For instance, the rate of emergency department visits due to accidental injuries among children under the age of 5 is 38%, with this rate being significantly higher in impoverished populations compared to wealthier ones. Although numerical data on HAs in Turkey are not definitive, a study reported that domestic accidents account for approximately 18 to 25% of all accidents. Additionally, it was noted that 50 to 80% of all fatal falls among children aged 0 to 6 occur at home. In Turkish society, the responsibility of child-rearing typically falls on mothers. Therefore, raising mothers' awareness about HAs and improving their knowledge of behaviors that may lead to such accidents are crucial for reducing their occurrence. HAs are often overlooked, and there is a scarcity of scientific research examining parents' knowledge about appropriate behaviors and attitudes to avoid during such incidents involving children. Particularly in the 1 to 3 age group, HAs occur more frequently due to factors such as weak motor skills, limited experience, and narrow visual fields. Nevertheless, there is a limited number of studies focusing on the awareness of mothers with children aged 0 to 3 regarding HAs. In this study, we aim to examine the awareness of HAs among mothers of children aged 0 to 3 and to identify the factors influencing this awareness. Methods. Our prospective cross-sectional study was conducted as a face-to-face survey with individuals visiting the pediatric health and diseases outpatient clinics of a private hospital. Ethical approval for the study was granted by the Istanbul Medipol University Non-Interventional Clinical Research's Ethics Committee. Date: December 9, 2024. Decision No. 876. The study was conducted in accordance with the Declaration of Helsinki. Participants were informed about the study, and written informed consent was obtained from those who voluntarily chose to participate. Subsequently, a questionnaire was administered, which was developed based on a literature review and included socio-demographic information such as age, education level, gender, income level, and occupation. Additionally, the Home Accidents Awareness Scale for Mothers, HAZM, was applied to assess awareness of HAs. Mothers aged 18 and above with children aged 0 to 3 who agreed to participate in the study were included. Participants under 18 years of age or those who did not complete the questionnaire and scales were excluded from the study. An average of 590 patients visit the pediatric health and diseases outpatient clinics of the private hospital monthly. During the planned 1-month study period, October 2024, the expected 590 individuals visiting the pediatric health and diseases outpatient clinics constituted the study population. Based on simple random sampling, the sample size was calculated at a significance level of alpha equals 0.05 and 95% power, resulting in a minimum required sample size of 233 participants. A total of 241 individuals agreed to participate in the study. However, 1 individual was excluded for being under the age of 18, and 4 individuals were excluded due to incomplete questionnaires and scales. As a result, the study was conducted with 236 participants. HAZM was developed in 2023 by Gulbedikin et al., and its validity and reliability were established. This scale consists of 55 items divided into 4 subdimensions: awareness of burns, falls, drowning, poisoning, and injuries caused by sharp or piercing objects. Higher scores on the scale indicate a greater level of maternal awareness regarding HAs. Statistical analysis. The distribution of demographic characteristics was presented using frequency, n, and percentage, percent symbol. The normality of continuous variables was assessed both graphically and using the Shapiro-Wilk test. Descriptive statistics were presented as mean plus or minus standard deviation or median, minimum, maximum, values. For the comparison of HASM scores across categorical variables with more than two groups, such as education level, occupation, income level, smoking status, and alcohol use, the Kruskal-Wallis nonparametric variance analysis was employed. The Mann-Whitney test was used to compare HASM scores between two group variables. The Spearman nonparametric correlation coefficient was calculated to analyze the relationship between HASM scores and variables such as maternal age, child age, number of children, and household size. IBM SPSS Statistics 21.0, IBM Corporation, 2012, Armonk, New York, and MS Excel 2007 were utilized for statistical analyses, with significance determined at p less than 0.05. Results: the mean age of the participants was 32.52 plus or minus 4.49 years, and the mean age of the children was 13.38 plus or minus 11.55 months. HASM scores ranged from 186 to 275, with a mean score of 256.39 plus or minus 17.85. It was found that 71.6%, n equals 169, of the participants had one child, 22.5%, n equals 53, had two children, and 5.9%, n equals 14, had three children. Additionally, 0.8%, n equals 2, of the participants lived in households with two people, 66.9%, n equals 158, in households with three people, 25.1%, n equals 59, in households with four people, and 7.2%, n equals 17, in households with 5 people. The comparison of HASM scores according to the demographic characteristics of the participants is presented in Table 1. A weak, negative, and statistically significant correlation was found between child age and HASM scores, R equals -0.208, P equals 0.001. No statistically significant correlation was identified between maternal age, number of children, or household size and HASM scores, P greater than 0.05. A statistically significant difference was observed in child age between participants whose children had experienced a home accident and those whose children had not, P equals 0.002, while no statistically significant difference was found in maternal age, P equals 0.062. Discussion: HAs in children are a significant concern, as they can lead to injuries and even fatalities. 12 Many young children are unintentionally injured in their own homes, places that are generally considered safe by everyone. 13 However, compared to other diseases, childhood injuries receive much less attention, despite their severity and preventability. In our study, which examined the awareness levels of mothers with children aged 0 to 3 years regarding HAs, no statistically significant differences were found in HASM scores based on demographic characteristics and other variables. However, a negative correlation was identified between child age and HASM scores. Carlson et al. Conducted an intervention study with mothers of children under the age of 7, which showed that the interventions and informational sessions increased awareness regarding HAs. In the study, a 3-question survey was used to assess awareness. Similarly, during the COVID-19 lockdown in Greece, a study was conducted with 140 parents of children aged 0 to 14 to investigate the practices implemented by families to prevent HAs. An online survey of 28 questions, created based on a literature review, was applied to the participants. The results indicated that the measures taken by the participants to prevent child HAs were insufficient and needed improvement. A 2024 study conducted in Saudi Arabia with 433 mothers of children, aged 1 to 12 measured knowledge and awareness regarding the prevention of HAs. The study did not use a standardized scale, but instead employed a survey created from literature research. In the survey, awareness levels were categorized as low for those scoring below 50%, moderate for those scoring between 50 to 75%, and high for those scoring 75% or above. The study found that 55% of participating mothers had a moderate level of awareness. Literature reviews indicate that studies on maternal awareness of HAs have used different age ranges and assessment scales. As far as can be determined, no studies have been found that use the HASM. The discrepancies in study results may be attributed to the variations in the scope of questions included in the scales or surveys employed. It is recommended to increase the number of studies using scales that have undergone validity and reliability testing. Applying the same scale across different patient groups could lead to more comprehensive and reliable outcomes. Al-Hadrami et al. Conducted a study in Saudi Arabia involving mothers of children aged 1 to 12 years, finding that 54% of the participants had a child who had previously experienced a home accident. Another study conducted in Saudi Arabia, which investigated the prevalence of HAs in children under 5 years old, showed that, among 352 parents, 205, 58.2%, reported that their child had previously experienced a home accident, most of which were falls and burns. In a study conducted by Aydoğdu et al. In Turkey with 244 mothers of children aged 0 to 6 years, it was found that mothers whose children had not previously experienced a home accident were more likely to recognize safety measures for HAs than mothers whose children had experienced one. In the study, 42.6% of the participants reported that their child had previously experienced a home accident. In a study conducted by Untitled et al. In Turkey, which explored the attitudes and knowledge of mothers with children aged 0 to 6 years regarding HAs and prevention strategies, it was found that 116 out of 217 participants, 58%, had at least one child who had experienced a home accident. In a study by Gündüz and Aitken with mothers of children aged 1 to 3 years, 229 out of 400 participants, 57.3%, reported that their children had previously experienced a home accident. In a study by Al-Rumi et al., children who presented to the emergency department due to HAs were retrospectively examined. The study categorized the children's age groups as 12 to 18, 6 to 12, 3 to 6, 1 to 3, and 0 to 1 years. Among a total of 1,333 emergency visits due to HAs, the smallest number and percentage were found in the 0 to 1 age group, 111 children, 8.9%, while the largest number and percentage were in the 1 to 3 age group, 370 children, 27.8%. In our study, it was determined that 12.7%, 30 participants, of the mothers had children with a history of HAs. Additionally, no statistically significant difference was found between mothers whose children had experienced a home accident and those whose children had not, in terms of their HASM scores. However, there was a statistically significant difference between those who had experienced HAs and those who had not, in terms of the children's age. One reason why our study has a lower prevalence of home accident history compared to other studies conducted in Turkey could be that it was conducted in a private hospital. Due to the socioeconomic advantages of the participants, they may have been able to take more precautions against HAs, and it is possible that their homes are structurally safer. Another reason may be that, unlike other studies, our study specifically involved mothers of children aged 0 to 3 years, and the higher educational level of the participant mothers, compared to those in other studies, may have contributed to the findings. Studies examining HAs in children frequently evaluate the education levels of families. Untitled et al. Divided the mothers of children aged 0 to 6 years into 2 groups based on their education level in their study: those with education below high school and those with high school or higher education. The study found that the group with higher education had significantly higher awareness of HAs. The study also emphasized that mothers with higher education and those who had received training and information on preventing HAs would play an important role in protecting children from HAs. Untitled et al.'s study, conducted in Turkey, explored the attitudes of mothers toward accident and injury prevention. The results of the survey indicated that accident prevention scores improved with higher education levels. On the other hand, in a study by Seisekler et al., it was found that mothers with only elementary school education took more safety measures against HAs compared to mothers with university degrees. Santos et al. In their study in Brazil with 256 participants caring for children under 6 years old, examined the relationship between the level of knowledge about precautions for HAs and education level. In the study, 170 participants, 66.4%, had education levels higher than high school, but there was no statistically significant difference in the level of knowledge about HAs based on education level. In our study, No statistically significant difference was found between the mother's education level and HASM scores. Although it is argued that mothers with higher education levels are likely to have more knowledge about child HAs, children's developmental characteristics, and risk factors for accidents, it should be noted that the level of knowledge about HAs may be influenced by access to information sources about home safety and cultural and social factors. When examining the factors affecting attitudes toward HAs, maternal age has been evaluated in several studies. In a study by Al-Hadrami et al., where more than 70% of the participants were over 30 years old, no relationship was found between maternal awareness of HAs and age. Similarly, in a study by Yukunku et al., mothers were divided into two groups, under 35 and 35 or older, but no significant difference in awareness of HAs was found between the groups. In Iderdu et al.'s study, the average age of participants was 30.8 years, and no relationship was found between age and the precautions taken regarding HAs. Consistent with the literature, our study found no statistically significant relationship between maternal age and HASM scores. Parents' attitudes and behaviors toward HAs may also vary depending on the child's age. In a study by Ince et al., participants were grouped as parents of children aged 0 to 1, 1 to 4, and 5 to 9 years. The group with the highest attitude toward preventing accidents and injuries were parents of children aged 0 to 1 years. In a similar study by Eichelberger et al., which included 404 parents of children under the age of 13, it was observed that parents of younger children were more inclined to engage in appropriate accident prevention behaviors. In our study, a statistically significant negative relationship was found between child age and HASM scores. This may be due to the increased care dependency of children aged 0 to 1 years, making their parents more vigilant about HAs for this age group. Papachristou et al. Demonstrated in their study that participants with 1 or 2 children took more preventive measures against HAs compared to those with more children. It was suggested that larger families may have less time to dedicate to children and to organizing protective measures against accidents. Yukunku et al. Observed in their study that as the number of children and the number of people living in the household increased, knowledge of HAs and the adoption of safety measures decreased. A study conducted in Saudi Arabia in 2023 found that in families with more than 7 members and families with more than 4 children, HAs occurred more frequently than in other families, with statistically significant results. However, in our study, no correlation was observed between the number of household members or the number of children and the HASM scores. This outcome may be attributed to the relatively high and more homogeneous socioeconomic status of the participants in our study compared to other studies, or to the limited variability in HASM scores due to the generally high levels of awareness among the participants, which may have hindered the detection of potential associations. Limitations. Our study has several limitations. First, the cross-sectional design makes it challenging to establish a causal relationship between awareness of HAs and associated risk factors. Second, the use of the scale exclusively on mothers, without considering the perspectives of both parents, constitutes a limitation. Third, the fact that the study was conducted in a private hospital limits the ability to generalize the findings to a larger population. Finally, the location and structural features of the homes, the presence of any psychiatric pathologies in the mothers, whether the mothers received first aid training, and the type of HAs experienced were not examined in our study. These factors can also be considered as limitations of the study. Conclusion: HAs are a major cause of morbidity and mortality in children globally. In our study, 12.7% of participants reported a history of HAs in their children. As children's age increased from 0 to 3 years, a decrease in mothers' awareness of HAs was observed. Considering that the risk of HAs increases with age, it is crucial to raise awareness, particularly regarding HAs for children nearing the age of 3. Community-based educational programs for mothers and families, as well as nationwide policies aimed at accident prevention, are recommended. Furthermore, conducting studies on HAs in different centers and among various patient groups could contribute to the prevention of accidents and provide a safer environment for children to grow up in.